The goal of obesity medicine treatment is to help patients achieve and maintain a healthy weight so they may help treat and prevent weight related conditions. And I'm going to talk about several of those conditions that need to be monitored while someone is on a weight management journey, and especially when they are starting to achieve those weight changes. What are these health conditions that we need to monitor, and how should we adjust those treatments? My name is Dr. Lindsay Olkel, and I'm a board certified obesity medicine physician. And I see patients all throughout the state of Missouri at Missouri Metabolic Health. And I utilize YouTube and podcasts and TikTok, Instagram to help share my medical knowledge with as many people as possible, because not everybody has access to specialty care. But this is really important information to be aware of, because about 1 in 8 to 1 in 9 people are on a GLP-1 medication at this time. And many people are not getting the guidance that they need. And so my goal is to help people make sure that they are utilizing these medications in a safe and effective way. But always talk to your doctor about what is best for you. Especially for an episode like this, I'm going to talk about specific medical conditions and some medication adjustments to be aware of, but none of this is direct medical advice. This is general medical knowledge to take to your doctor to apply to your specific circumstance. I thought about this topic because I recently saw a patient who has been doing very well on her GLP-1 medication and has lost a little bit over 10% of her total body weight. And she has a few weight related conditions that we now need to start monitoring to make sure that her treatments are adjusted appropriately in the setting of this weight loss. I also had somebody reach out to me on TikTok about a similar question. So I'm going to go through some of these health conditions. The first is thyroid disease. And weight and thyroid, it can be intimately connected, and that goes outside the scope of this talk on how they are connected, and would be a great topic for a future video or podcast. So subscribe to follow. But as your weight changes, whether that is increasing weight or decreasing weight, that will affect your dose of thyroid replacement or any thyroid disease medications that you are on. So if you are on thyroid replacement and you are on a weight loss journey, talk to your doctor, and you probably need more frequent testing of your thyroid levels and may need an adjustment of your thyroid replacement. So thyroid disease, especially hypothyroidism, low thyroid, some of the common medications for that are levothyroxine or Synthroid. If you're on those medicines, make sure that your doctor knows that you're having this weight loss and be tested more frequently for your thyroid levels to make sure you are on an appropriate dose. Another common weight-related condition is type 2 diabetes. And as many people know, GLP-1 medication started out specifically for type 2 diabetes, or that was their only FDA indication for many years. Now they're FDA approved for obesity and prevention of cardiovascular disease, obstructive sleep apnea, and metabolic associated dysfunction, steatotic liver disease, or MASLD. And I recently did a whole video on that condition, which I will link here. But if you have type 2 diabetes and you're on a GLP-1 or any obesity treatment, you should work closely with your doctor to adjust your other type 2 diabetes medications. This will likely mean reducing your other medications slowly over time, especially if you are on insulin or sulfonylureas. Those two medications, or two groups of medications in particular, can increase your risk of low blood sugar when on a GLP-1, and so your blood sugars need to be monitored more closely. So work with your doctor if you have type 2 diabetes and are on treatment for your obesity. This can be a great time to utilize a continuous glucose monitor, or CGM. So ask your doctor if that may be appropriate for you. These can be excellent tools, so you don't have to constantly be poking your finger. You just wear a continuous glucose monitor. Most of them are set up to be worn for 2 weeks at a time. The next condition is high blood pressure. So anybody who is on blood pressure medication and is losing weight, and especially if you are changing the way that you're eating or the amount of alcohol that you're drinking or how physically active you are, all of those things are going to impact your blood pressure and help lower it over time. So if you're on a blood pressure lowering medication and are on obesity treatment, you need to closely monitor what your blood pressure is or the symptoms that you're having. So if you're feeling lightheaded or dizzy or tired, that is a time to check your blood pressure. And if it's starting to be on the low end for you, talk with your doctor, and your blood pressure medicine should probably be lowered in their dose or may be able to be discontinued altogether. Acid reflux is another condition that is related to excess weight, and that will likely get better on treatment for obesity. Medications to treat acid reflux, there's several, but many of the common ones are omeprazole, pantoprazole, famotidine. If you are on these medications, there could be other reasons that you're on it, and you should always check with your doctor. But it could be time to trial a lower dose or maybe going off of it. These may be, again, ones that need to be titrated off, so talk to your doctor. And they're ones that can be forgotten about, and sometimes people get started on it and do not get off of it at any time. So if you know you were started on it for heartburn and you've been losing weight and you're not experiencing heartburn right now, talk to your doctor and then work on potentially getting off of that medicine. Sleep apnea is another diagnosis that tends to be weight related, not always. And as I mentioned earlier, Zepbound is now FDA approved for the treatment of sleep apnea. So if you are on Zepbound specifically, you're also treating your sleep apnea. But what I really wanted to highlight here is if you are utilizing CPAP or BiPAP to treat your sleep apnea and you are on treatment for your disease of obesity, if the obesity is improving and you're losing weight, you likely may be able to reduce your BiPAP or CPAP strength or potentially go off of your machine altogether. This is something that you definitely need to work with your doctor about and may need to have a repeat sleep study to ensure, but is worth looking into, especially if you're struggling with your BiPAP or CPAP at all. This is something to take a look at. So those are the main weight-related conditions that treatments should be titrated to along with the treatment of obesity. Again, this is general medical knowledge, and talk with your doctor, but I wanted to highlight these conditions and just bring them to your attention so you can be aware and monitor for any of your symptoms that may be changing, and or talk to your doctor about adjusting the treatment along the way. I hope you found this helpful, and I'm so happy that you are on this journey. And again, the whole goal of obesity treatment is to treat and prevent weight-related conditions. This is the goal, and it is a joy and so fun to work with patients on this journey and being able to reduce or take them off of other medications. And that is ultimately my goal with my patients, is to keep them happy and healthy for as long as possible. And I hope the same for you.